Hi everyone. Good day. My name is Eliza Braga, a BSN 11G student nurse from Davao Doctors College. And today I am going to perform the preparing medication from an ampule and vial and parenteral medication administration. So before we start, we need to prepare the necessary equipment such as our alcohol, our working gloves, our waste bins for the syringe and cotton swabs, our 3 cc syringe, and as well as our 1 cc syringe. And I also have here medicine tray, cotton swabs, which was soaked with 70% solution of alcohol, our sterile water, our vial, and our ampule. We have here gauze pad and our um, documentation pad. And I also have here our pen and dry cotton balls. Okay. First is check the doctor's order. This is done to see if the medication is correctly prescribed and dispensed before administration. Check the medication administration record or MAR, which is this. This is done to avoid medication errors. Check the label of the medication carefully against the MAR to make sure that the correct medication is being prepared. Follow the 3 checks for administering medications and read the label on the medication. Okay. For read the label on the medication, which is one is it taken from the medication cart, and two before withdrawing the medication, and three being after withdrawing the medication, to make sure that the correct medication is being prepared. Next is organize the equipment, which I already did for effective time management. And now we'll head on to preparing for vials. Perform hand hygiene and observe other appropriate infection prevention procedures to deter the spread of microorganisms. Prepare the vial for drug withdrawal. Mix the solution if necessary by rotating the vial between the palms of the hand, not by shaking. Some vial contains aqueous suspensions which settle when they stand. In some instances, shaking is contraindicated because it may cause the mixture to foam. So, okay, we'll just do this. Remove the protective cap and clean the rubber cap of a previously or clean the rubber cap of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. The antiseptic cleans the cap and reduces the number of microorganisms. So we'll just do this and discard the waste. Ensure that the needle is firmly attached to the syringe. Remove the cap from the needle, then draw up to the syringe the amount of air equal to the volume of the medication to be withdrawn. Okay. Before I actually forgot, we have to don our gloves first to Add um, more protection to ourselves while doing the procedure. Okay, I'm going to remove the cap of the needle by using my non-dominant hand while holding it with my dominant hand. Draw into the syringe the amount of air equal to the volume of the medication to be withdrawn. Okay. Then carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Using the filter needle prevents any solid particles from being drawn up through the needle. Okay. Next is inject air into the vial, keeping the bevel of the needle above the surface of the medication. The air will allow The air will allow the medication to be drawn out easily because negative pressure will not be created inside the vial. The bevel is kept above the medication to avoid creating bubbles in the medication. Okay, we've already had the amount of medication we needed here in a vial, and we'll just recap it. Withdraw the prescribed amount of medication using either of the following methods. Hold the vial down with the base lower than the top. Move the needle tip so that it is below the fluid level and withdraw the medication. Or B. Insert the vial, ensure the needle tip is below the fluid level, and gradually withdraw the medication. Keeping the tip of the needle below the fluid level prevents air from being drawn into the syringe. Perform hand hygiene and observe other appropriate infection prevention procedures to deter the spread of microorganism, which is I've already done it. Prepare the medication ampule for drug withdrawal. Okay, I have here my ampule. I'll just set my syringe here in my medication tray and put a label. Next is ampule withdrawal. Flick the upper stem of the ampule several times with a fingernail. This will bring all medication down to the main portion of the ampule. Use an ampule opener or place a piece of sterile gauze or alcohol wipe between your thumb and the ampule neck or around the ampule neck and break off the top by bending it toward you to ensure that the ampule is broken away from yourself and away from others. The sterile gauze protects the fingers from the broken glass, and any glass fragments will spray away from the nurse. Place the antiseptic wipe. Okay, I'll just wipe it. Place the antiseptic wipe packet over the top of the ampule before breaking off the top. And then after that, we'll dispose the top of the ampule in the sharps container to prevent anyone from getting cut with sharps. Okay. So I already have my ampule here. And what I need to do is withdraw the medication. With a single dose ampule, hold the ampule slightly on its side and aspirate medication. If giving an injection, replace the aspirating needle with a regular needle This filter needle or straw prevents glass particles from being withdrawn with the medication, so we have to change it to prevent sharps from entering the body. Okay, I'll just uncap it and put some air in the desired amount. And I'll just recap it using a scooping method and discard the empty ampule and then label the syringe. And I'll just put it on my medication tray. We have to remember to tighten the cup at the hub of the needle and place it over the medication tray. Okay? Now, we'll move on to the subcutaneous injection. Um, as I don't have any patient, I provided an eggplant to where I can perform the injection part of my assessment. Okay, okay. I'll just discard the parts that are not needed. Next is we have to perform hand hygiene again and observe other appropriate infection prevention procedures to promote safe drug administration and to deter the spread of microorganisms. Okay. I'll just done another set of gloves for my next procedure. Okay. I'm done putting on my gloves. Provide for client privacy and prepare the client. This decreases embarrassment and promotes comfort to the patient as well as gaining cooperation and reduces anxiety. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Since I don't have since I don't have someone with me right now, I'll just do this procedure on an eggplant. Okay. And what you need to do if you have a client is assist them to a position which the arm, leg, or abdomen can be relaxed depending on the site to be used to establish rapport and ensure that the right client receives the right medication. Obtain assistance in holding an uncooperative client. This prevents injury due to sudden movement after needle insertion. Next is you have to explain the purpose of the medication and how it will help using language that our client can understand. Include relevant information about effects of the medication. Information can facilitate acceptance of and compliance with the therapy and it promotes cooperative and reduces anxiety. Select and clean the site free of tenderness, hardness, swelling, scarring. itching, burning, or localized inflammation. Select a site that has not been used frequently. These conditions could hinder the absorption of the medication and may also increase the likelihood of injury and discomfort at the injection site. Apply clean gloves. This prevents contamination of hands and reduces risk of infection transmission, which I already did. As agency protocol indicates, clean the site with the antiseptic swab. Start at the center of the site and clean in a widening circle about 5 centimeter or 2 inches. Okay. Allowing the area to dry prevents irritation and injection site from alcohol. Circular motion and mechanical action of swabbing removes skin secretions which contain microorganisms. Place and hold the swab between the third and fourth finger of the non-dominant hand, which I already did, and I discarded it, or position the swab on the client's skin above the intended site. Using this technique keeps the swab readily accessible when the needle is withdrawn. Prepare the syringe for injection. Remove the needle cap while waiting for the antiseptic to dry. Okay. Pull the cap straight off to avoid contaminating the needle by the outside edge of the cap. The needle will be contaminated if it touches anything except the inside of the cap, which is sterile. Next is where I will inject the medication. Grasp the syringe on your dominant hand by holding it between your thumb and fingers with palm facing to the side or upward for a 45-degree angle insertion or with the palm downward for a 90-degree angle insertion and prepare to inject. Quick smooth injection is easier with proper position of syringe. Using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand and a firm, steady push. Okay. Needle penetrates tight skin easier than loose skin. Pinching skin elevates subcutaneous tissue and prevents trauma to tissue. When the needle is inserted, move your non-dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the dominant hand to the end of the plunger. Injection requires smooth manipulation of syringe parts. Movement of syringe may cause discomfort. Inject the medication by holding the syringe steady, depressing the plunger with a slow, even pressure. Holding the syringe steady and injecting the medication at an even pressure minimizes discomfort for the client. Next is remove the needle. Remove the needle softly, pulling along the line of insertion while depressing the skin with your non-dominant hand. Depressing the skin places counteraction on it and minimizes the client's discomfort when the needle is withdrawn. If bleeding occurs, apply pressure to the site with dry, sterile gauze or cotton until it stops. Use of alcohol swab may cause the pain or a burning sensation. Dispose of supply appropriately after doing the procedure. Proper disposal protects the nurse and others from injury and contamination. So, let's get a dry cotton and remove the needle slowly. Okay, I'm just going to recap it using the scooping method. So, and discard it. Okay. As after that, assist the patient into a comfortable position. Flip down the medication ticket if not using MAR. Do aftercare. Remove gloves. Dispose used items. inappropriate waste receptacles, and return other equipment to its proper place, especially the MAR machine, to reduce microorganism transfer among clients and prepare equipment for future use. Perform hand hygiene to deter the spread of microorganisms. Assess the effectiveness of the medication at the time it is expected to act to make sure that you did not that you did the task right and there are no errors for reporting and recording. And document all the relevant information. This provides legal record medication administration and it prevents accidental remedication. Now, we move on to our intramuscular injection. Assist the client to a supine lateral prone or sitting position depending on the chosen site. If the target muscle is in the gluteus medius, have the client in the supine position flex the knee or knees in the lateral position, flex the upper leg, and in the prone position, toe in. Appropriate positioning promotes relaxation of the target muscles. Obtain assistance in holding an uncooperative client. This prevents injury due to sudden movement after needle insertion. Explain the purpose of the medication and how it will help the patient using language that the client can understand. Include relevant information about effects of medication, and if that's because information can facilitate acceptance and compliance with the therapy. Select, locate, and cleanse the site. Select the site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. These conditions could hinder the absorption of the medication and may also increase the likelihood of injury and discomfort at the injection site. If injections are to be frequent, alternate sites. Avoid using the same site twice in a row. Locate the exact site for injection. Locating it helps to reduce the discomfort of intramuscular injections. Apply clean gloves. Wearing gloves decreases the risk of transmission of microorganisms. To reduce the risk of contamination of healthcare workers' hands with blood and other body fluids. Clean the site with an antiseptic swab. Using a circular motion, start at the center and move outward um, about 5 centimeters or 2 inches. The mechanical actions of swabbing remove the skin secretions which contain microorganisms. Transfer and hold the swab between the third and fourth fingers of your non-dominant hand in readiness for needle withdrawal or position the swab on the client's skin above the intended site. This will help reduce the discomfort of the injection. Okay, I have to discard the used swab. And now I have to prepare the syringe for injection. Remove the needle cover and discard without contaminating the needle. If using a prefilled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If this does occur, wipe the medication off the needle with a sterile gauze. Medication left on a needle can cause pain when it is tracked through the subcutaneous tissue. Inject the medication using the Z-track technique. Use the ulnar side of the non-dominant hand to pull the skin approximately 25 centimeters or 1 inches to the side. Under some circumstances, such as for an emaciated client or an infant, the muscle may be pinched. Pulling the skin and subcutaneous tissue or pinching the muscle makes it firmer and facilitates needle insertion. Holding the syringe between the thumb and forefinger as if holding a pen, pierce the skin quickly and smoothly at a 90 degrees angle. Using a quick motion lessens the client's discomfort. Okay? Hold the barrel of the syringe steadily with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. If the needle is in a small blood vessel, it takes time for the blood to appear. If blood appears in the syringe, withdraw the needle and discard the syringe and prepare a new injection. Aspiration of blood indicates intravenous placement of needle. If blood does not appear, inject the medication steadily and slowly, approximately 10 seconds per milliliters. Injecting the medication slowly promotes comfort and allows time for tissue to expand and begin absorption of the medication. Okay, I'll just need to aspirate for about 5 seconds is enough. Okay, there's no blood. So I'm going to inject the medication now and use a dry cotton swab. Withdraw the needle smoothly at the same angle of insertion. This minimizes tissue injury. Apply a gentle pressure at the site with a dry sponge. Use of alcohol swab may cause pain or a burning sensation. It is not necessary to massage the area at the site of injection, but if bleeding occurs, apply pressure with a dry sterile gauze until it stops. Activate the needle safety device or discard the uncapped needle and attach syringe to the proper receptacle. Proper disposal protects the nurse and the other from injury and contamination. The CDC recommends that capping the needle before disposal to reduce the risk of needle stick injuries. Okay, I'll just recap it using the scooping method and discard it. Remove and discard your glove and perform hand hygiene to prevent the spread of microorganisms. Okay. Document all relevant information. This includes the time of administration, drug name, dose, route, and the client's reaction for recording and reporting purposes. Assess the effectiveness of the medication at the time it is expected to act. This promotes patient safety and quality of care. Okay, now I'm done. And thank you for watching my return demonstration on parenteral administration.